Thank you for joining our health webinar entitled How to Combat the Complications of Diabetes. It's estimated that 23.5 million American adults have either type 1 or type 2 diabetes. And I use the word estimated because type 2 diabetes is growing at an epidemic rate. Why? Because the Center for Disease Control and Prevention states that there are 58 million American adults in a pre-diabetic condition. This means that they have higher than normal blood sugar levels, but not yet high enough to put them in the diabetes category. When you add these two numbers together, over 1/3 of the American adult population either has diabetes or is in a pre-diabetic condition. I want to thank you for joining our health webinar. I'm part of a team whose mission is to help save 1 million lives, and that mission starts with you and your loved ones. High blood sugar causes damage to your cardiovascular system, which results in the complications of diabetes, such as poor circulation, poor kidney function, cardiovascular disease, high blood pressure, and the increased potential for strokes and heart attacks. All are life-threatening. I'm here to tell you it doesn't have to be this way. There are two approaches to controlling the complications of diabetes. The first is controlling your blood sugar levels. This is vital and absolutely necessary. Most people understand this approach, so I'll not spend any time on it. But I will spend time on the second approach. Why? Because the second approach is very seldom implemented, but can make all the difference. It's an approach designed to repair the damage blood sugar causes your cardiovascular system. The doctor who pioneered this approach is Dr. J. Joseph Prendergast. Dr. Joe, as he prefers to call himself, is a highly regarded endocrinologist from Palo Alto, California. Dr. Joe has been using this approach since 1991. He has treated more than 7,000 patients and has seen phenomenal results. It's important to note that the vast majority of his patients are diabetics. This webinar will help you understand Dr. Joe's approach. It's an approach that you can implement in conjunction with your healthcare provider to make significant improvements in your cardiovascular health. As Dr. Joe says, quote, "Many people still think diabetes is a disease about sugar. It's not the sugar, it's the complications," end of quote. Dr. Joe's approach centers on repairing the damage done to one critical organ and helping it to function properly. It's an organ that you must pay attention to if you want to reduce and potentially eliminate the complications of diabetes. This organ is not your heart, but an organ that actually controls the health of your entire cardiovascular system. It's called the endothelium. Your endothelium is only 1 cell thick, but it lines the inside of your heart. The inside of all your arteries and arterioles, veins and venules are lined by this organ. Your capillaries are just extensions of the endothelium. Scientists and researchers once thought this 1 cell thick lining was just an inert membrane that didn't have any purpose other than to keep your blood in the vascular system. But research over the last 10 years has clearly shown the endothelium to be a multifunctional organ involved in metabolic, immunologic, and cardiovascular health. One of those functions is to convert the amino acid L-arginine into nitric oxide. However, before we talk about nitric oxide, especially as it applies to the complications of diabetes, I'd like you to get a feel for how large an organ your endothelium is. It's estimated that there are approximately 60,000 miles of blood vessels in the adult body. Every blood vessel is lined by the endothelium. If you took out your endothelium and spread it on a flat surface, it would cover a surface volume of 4 to 8 tennis courts, depending upon the size of the individual. Your endothelium is the largest secreting organ in your body, and for many of you, this webinar is the first time you're getting any in-depth information about it. In fact, this organ and its ability to create nitric oxide is so important to your health that the 1998 Nobel Prize in Medicine was awarded to 3 American researchers who discovered how the endothelium converts the amino acid L-arginine into nitric oxide, the master signaling molecule of your entire cardiovascular system. So the question is, how does this organ and its ability to produce nitric oxide apply to diabetic health? In a nutshell, high blood sugar causes oxidative stress to your endothelial cells. This means your endothelium is directly damaged, which results in less nitric oxide production. This leads to a whole host of cardiovascular problems, resulting in poor circulation and most of the complications associated with diabetes. Historically, most treatment programs concentrate on controlling blood sugar. This is vitally important because high blood sugar directly damages the endothelial cells. This damage and the continuing damage of high blood sugar over time creates the cumulative effect which reduces the function of your endothelium. So learning how to properly control your blood sugar is important to reducing the potential damage to this organ. But unless you heal the damage done and the ongoing damage being done, the complications of diabetes will continue to grow. Enter the second approach, an approach pioneered by Dr. Joe. It centers on repairing the damage to the endothelium by properly nourishing the endothelial cells for improved nitric oxide production. Very few physicians and medical professionals take this approach, yet this is the approach of Dr. Joe. And I want to be very clear about this. Dr. Prendergast is not discounting the need to control your blood sugar. That's critically important. What he's trying to get people and the medical profession to understand is that unregulated blood glucose causes high levels of oxidative stress, which directly damages the endothelium and its ability to properly produce nitric oxide. To prevent the cardiovascular complications of diabetes, you must repair this damage and any future damage to the endothelium. In pioneering this approach, Dr. Joe has taken Nobel Prize-winning science and cutting-edge vascular research and put it into practical clinical application to benefit his patients. By properly combining 2 amino acids with several important vitamins and nutrients, Dr. Joe has been able to naturally repair the endothelium and properly nourish it for improved nitric oxide production. This has substantially reduced the complications of diabetes for his patients. Now, before we talk about the nutrients that can naturally repair the endothelium, I'd like to ask you this question. If you could learn how to effectively address 66% of the complications associated with diabetes and do it naturally without drugs, wouldn't you want to know how? Most of the people I ask this question to say yes. Well, here are 2 important statistics to keep in mind as it applies to the complications of diabetes. 66% of diabetics have high blood pressure. 66% of diabetics die from a heart attack or stroke. While the cardiovascular complications associated with diabetes are staggering, it's these 2 that pose the greatest risk to a person's health and longevity. 2/3 of all diabetics are confronted with this daily reality, and your body has an organ that produces a gas that naturally addresses these 2 statistics to greatly reduce your risk. It's why Nobel laureate in medicine Dr. Louis J. Ignarro can make the following statement on his 2005 national bestseller, No More Heart Disease. Quote, "How nitric oxide can prevent, even reverse, heart disease and strokes." End of quote. Your endothelium produces a gas called nitric oxide. There is not a cell, tissue, or organ in your body that is not directly or indirectly affected by nitric oxide. You could not live without nitric oxide. It's that critical to your health and function. I'm not going to go into all the benefits of nitric oxide because we want to focus on how it applies to the complications associated with diabetes. So let me put up those 2 statistics on the screen so that you can see how nitric oxide directly addresses them. Again, 66% of diabetics have high blood pressure. 66% of diabetics die from a heart attack or stroke. Nitric oxide impacts the cardiovascular system in 2 extremely specific ways. First, nitric oxide regulates the muscle tone of blood vessels to have a major impact on controlling your blood pressure. In fact, nitric oxide is your body's most powerful vasodilator. This means it causes the smooth muscle of your vascular wall to relax. This helps to reduce blood pressure and improves blood flow throughout the vascular system. Since 66% of all diabetics have high blood pressure, By improving their ability to properly produce nitric oxide, you can aid them in better regulating their blood pressure. Because high blood pressure is the #1 risk factor for a stroke and heart attack, you will also help them to substantially reduce this risk. Second, nitric oxide keeps blood platelet cells from grouping together to form a clot. 87% of all strokes are caused by a blood clot. Thus, nitric oxide naturally reduces the #1 cause of strokes and heart attacks. As you can see, nitric oxide directly addresses 3 of the health complications of diabetes: high blood pressure, strokes, and heart attacks. It's so critical to everyone's health that Nobel laureate Dr. Ignarro had this to say about nitric oxide, quote, "is produced by the body specifically to help keep arteries and veins free of the plaque that causes stroke and to maintain normal blood pressure by relaxing the arteries, thereby regulating the rate of blood flow and preventing coronaries. Nitric oxide is the body's natural cardiovascular wonder drug." End of quote. This means that you can use a natural method to address these 3 specific issues, a method that has been pioneered by Dr. Prendergast and is making a huge difference in the overall health and function of diabetics. It's a method that centers on proper supplementation using therapeutic levels of the amino acids L-arginine and L-citrulline, a method that could help millions of diabetics to reduce their risks for these cardiovascular complications. Before we continue looking at this method, there is one more point to make about the significance of nitric oxide for diabetics. As I stated earlier, high levels of blood glucose cause oxidative stress or damage to the endothelium. This damage can lead to plaque formations, which over time can narrow the interior of the vascular wall, leading to a disease called atherosclerosis. This can result in poor blood flow, an increased risk for high blood pressure, and the formation of a blood clot leading to a stroke or heart attack. Nitric oxide, when at sufficient levels in the bloodstream, can heal damage done to the endothelium to keep it healthy, and current research indicates that nitric oxide can help to reverse plaque formations to help return the endothelium and vascular wall to a supple and healthy state. The result of this process is improved circulation and blood flow. This improves the delivery of oxygen and nutrients to the cells, tissues, and organs. This also aids in the body's ability to properly use blood glucose as an energy source. Bottom line to all this is that many of the complications of diabetes go away. You still need to watch your blood sugar levels, but at least you're taking an active approach to limiting and repairing the damage done to the endothelium. To help you understand how your endothelium produces nitric oxide, I'd like to introduce you to 2 amino acids. The first amino acid is L-arginine. It's considered a semi-essential amino acid. This means that your body cannot produce enough of it to maintain optimal health. Thus, you need to get L-arginine from the foods you consume or through proper supplementation. As you can see by the PowerPoint slide, I've listed some common food sources in which to obtain this amino acid. Let me make a few general comments. Most research indicates that for you to receive a therapeutic benefit from L-arginine, you need to consume at least 5 grams of this amino acid at one time. So I selected 6 food items that I thought would be common food choices. I did the math conversions to look at how much food you would need to eat to take in 5 grams of L-arginine. I also looked at the number of calories and grams of fat it would bring into your body. As you can see by the slide, peanuts provide the smallest quantity of food, but they pack on 70 grams of fat and 918 calories. When you examine this slide, you can see that the 3 best choices are beans, tuna, or chicken breast. 1 can of beans or 2 cans of tuna or almost 1 pound of chicken are needed on a daily basis. This quantity of food is necessary to have a significant therapeutic effect on your endothelial cells and their ability to properly produce nitric oxide. The other amino acid is L-citrulline. L-citrulline recycles L-arginine to help turbocharge the endothelium's ability to create nitric oxide, especially over a longer period of time. Watermelon is your one and only good food choice. Unfortunately, 60% of the L-citrulline is contained in the rind portion of the watermelon, which most people never eat. You would have to eat over a pound of watermelon to get even close to the amount of L-citrulline your body would need for a therapeutic effect. When people realize all the food they need to eat and the limited menu they have to choose from, they begin to ask the question, is it better to get these critical amino acids through supplementation? Now, before we talk about supplementation, I need to make one more important point about these two amino acids. When you bring in a therapeutic level of L-arginine, it typically results in a 30-minute to 2-hour window of improved nitric oxide production. When you combine your L-arginine with a therapeutic level of L-citrulline, you increase this production of nitric oxide to an 18 to 36-hour window. This has huge health benefits, especially for those with diabetes or any type of cardiovascular health issue. Let's look at the major complications of diabetes and how the health of your endothelial cells and their ability to properly produce nitric oxide over an extended period of time can make a difference. Poor circulation. By repairing and nourishing your endothelial cells to properly produce nitric oxide, you will improve circulation. High blood pressure. Nitric oxide is the most powerful vasodilator your body produces, which relaxes the vascular wall to reduce blood pressure. By having healthy and properly functioning endothelial cells, you will dramatically help your body control blood pressure. Cardiovascular disease. According to the American Heart Association, 74% of all heart disease and death is due to arterial sclerosis and atherosclerosis, which all centers on damage to the endothelial cells. If you properly repair and nourish these cells, then you limit and actually reverse this damage to have a huge impact on reducing the risk for cardiovascular disease. Increased risk for strokes and heart attacks. Nitric oxide keeps blood platelet cells from sticking together. This prevents blood clots and substantially reduces the risk for strokes and heart attacks. Improper wound healing. One of the functions of the endothelial cells is angiogenesis, which is the formation of new capillaries. This is extremely important for proper blood flow for your heart, tissues, and organs, and it's critical in wound healing. Wound healing is a common problem for diabetics. By helping to properly nourish your endothelium and improve its function, you're also improving its ability to help heal wounds. By repairing and nourishing your endothelial cells to enhance their ability to properly produce nitric oxide, you can have a significant impact on limiting and preventing the complications of diabetes. As you can see, both L-arginine and L-citrulline are important to the health of your endothelium. According to Nobel laureate Dr. Louis J. Ignarro, quote, any supplement program that does not contain L-citrulline and antioxidants to augment the L-arginine, and most on the market do not, is missing out on a major piece of the potential of nitric oxide to improve your cardiovascular health. End of quote. All of the information I've shared with you has been designed to help you understand the need to properly repair and nourish your endothelial cells. Since 1991, Dr. Prendergast has been helping his patients experience significant repair of their endothelial cells by improving their ability to properly produce nitric oxide. Dr. Joe has been using the amino acids L-arginine and L-citrulline with other vitamins and nutrients to pioneer this second approach. So the question becomes, is there a product that specifically addresses the health of the endothelium and its ability to properly produce nitric oxide? And the answer is yes, there is. I'd like to recommend to you ProArgi9 Plus from Synergy Worldwide. ProArgi9 Plus contains both L-arginine and L-citrulline at the needed levels to help turbocharge your endothelium's ability to produce nitric oxide over an extended period of time. In addition to these two amino acids, ProArgi9 Plus also includes the following ingredients: vitamins B9, B6, B12, vitamin D3, vitamin K2, vitamin C, D-ribose, grape skin extract, red wine extract, pomegranate extract. Now, I'm not going to go into detail about each ingredient, but I would like to highlight the science and manufacturing expertise that has gone into the development of this product. ProArgi9 Plus is manufactured by Nature's Sunshine Products and distributed by Synergy worldwide. Nature's Sunshine is 40 years old. They're one of the most respected nutritional manufacturers in the world. Both Synergy and Nature's Sunshine have received the NSF Good Manufacturing certification, which means that they meet the highest standards in the nutrition industry for quality assurance and control. The manufacturing process to create the proprietary formulation of ProArgi9 Plus is second to none. A total of 247 tests are conducted along the various stages of manufacturing to ensure the highest quality and potency of the ingredients used. And once a batch has been produced, it must also pass through 15 additional tests before receiving its final stamp of approval. This level of quality is reflected in the people who are associated with this product. On the screen is Dr. J. Joseph Prendergast, considered by many to be one of the leading authorities in the world on the use of L-arginine L-citrulline therapy for the treatment of cardiovascular concerns. We've talked about Dr. Joe's pioneering approach to addressing the complications of diabetes by addressing the damage done to the endothelium. Dr. Joe has been using L-arginine L-citrulline therapy since 1991 to help his diabetic patients experience phenomenal results. Dr. Joe contributed his 20 years of practical experience and research with the nutritional scientists at Nature's Sunshine Products to develop the ProArgi9 Plus formulation, what many consider to be the best nitric oxide supplement. What also makes ProArgi9 Plus unique in the nutrition industry is that it has clinical application and studies to back up its effectiveness. The High Desert Heart Institute is located in Victorville, California. They're considered one of the premier heart institutes in the world. In late 2009, they did a human clinical study using ProArgi9 Plus. In fact, it's the most complete and comprehensive human clinical study ever done on a nutritional supplement. This study involved 33 congestive heart failure patients who were all medically and pharmaceutically managed to the maximum. Over a 90-day period, these patients were given an aggressive amount of ProArgi9 Plus, and by the end of 90 days, all patients had their medications substantially reduced. Dr. Siva, who is the director and founder of the High Desert Heart Institute, made the following statement in a recent interview, quote, "What we ended up seeing was remarkable positive remodeling of the heart, positive pulmonary artery changes, pulmonary vascular changes in terms of pulmonary pressures, changes in cardiac dimensions, changes in heart function." End of quote. Because of these remarkable changes to their patients, the High Desert Heart Institute now uses ProArgi9 Plus as part of their standard treatment program for their patients. So, what does all this information mean to you? As we've already discussed, nitric oxide is the master signaling molecule of your entire cardiovascular system. You could not live without nitric oxide. It is key to helping improve and prevent the complications of diabetes. Uncontrolled blood sugar causes oxidative stress and damage to your endothelial cells. Proper nitric oxide production helps to repair and prevent this damage. This improves blood flow and circulation. Most of the complications of diabetes are a result of damage to the vascular system and a reduction in blood flow to the tissues and organs. When you properly combine L-arginine and L-citrulline with other heart-healthy ingredients, you can begin to properly repair and nourish your endothelial cells. Combine this with a standard approach of controlling blood sugar, and you have the potential to substantially reduce the health complications associated with diabetes. This is the overall method that Dr. Joe has used in his practice to achieve the phenomenal results he has seen with his patients. And I want to be very clear that ProArgi9 Plus is not designed to control your blood sugar. It may aid in this area, but you still need to apply the traditional method of keeping your blood sugar under control. ProArgi9 Plus is designed to nourish the endothelium, to help it properly produce nitric oxide. This may aid in the healing of the endothelium and improve circulation. It's why we encourage you to take our 90-day health challenge. We believe ProArgi9 Plus can help you combat the negative effects of premature cardiovascular aging that leads to many of the complications of diabetes. ProArgi9 Plus comes with a 90-day, unconditional money-back guarantee. So when you factor in ingredients, price, quality assurance, clinical studies, and a money-back guarantee, ProArgi9 Plus has the best value at an extremely competitive price. This leaves us with a final question. Are you ready to commit to the 90-day health challenge to see if ProArgi9 Plus can aid you in reducing the cardiovascular complications associated with diabetes? If your answer is yes, then please contact the person who invited you to this webinar. They can assist you in your purchase of ProArgi9 Plus and help you properly start on this excellent product. Or you can contact us at the Synergy Co-op. I've placed our contact information on the screen. As I said earlier, we're part of a team whose mission is to help save 1 million lives. We'll work with you and your healthcare provider to help you properly nourish your endothelium for improved nitric oxide production. And if for any reason you're not satisfied with your results during the 90-day health challenge, then you can return all the product, used and unused, for a full refund. Please call us if you have any questions about this remarkable product.